Hi, it's Lisa from OakleyPhysio, and I'm just going to show you a few tips and a few different ways that you can help when you're experiencing pelvic girdle pain during pregnancy. So in my experience with a lot of patients, they often tell me the things that bother them most, or the things that cause them the most pain, are turning over in bed, getting in and out of a car, getting in and out of a bath, and generally getting up from a seated position, and especially if they've been sat for too long. So I'm just going to show you a couple of ways that you can make this a little bit easier. And in my experience, when I've shown this to patients and done this with them in the clinic setting, this has been helpful and they've been in less pain when I've been with them. And then hopefully that carries over into their daily life when they remember to do these things the right way. So if you can do it the right way most of the time, you can generally get away with it. But if you continue to do things in a bad way for your pelvis, then it's going to continue to give you pain and may make pain worse. So let's see what we can do. First of all, then, sitting on your bed, and if you're going to go down onto your side, I'm going to be going down onto my right side, and you don't have to sleep on your left side unless you've been told by your midwife or by your doctor that you have to lie on your left side. There is no reason why you can't lie to sleep on your right side. The left side is really just as a way to recover if you have felt unwell, felt dizzy, felt like you're going to pass out or anything like that. It's going to be giving you better venous return to the heart, better deep breaths, just because of the position of the heart and the lungs. Now, if you're going to go down onto your side, it depends on which side of the bed you sleep in and what side you're more comfortable sleeping in. You get used to sleeping on one side, most people do. If you're going to go down onto your right side on the bed, so you take your head down onto the pillows, but at the same time lift your legs up together if at all possible. If your bed is really, really high, this might not be completely possible, but try and keep your legs together as much as you can. So move yourself close enough to the pillow that your head is just going to go down onto it, and as you do so, you lift your legs up, and then you bring yourself back into the bed, moving with your hands and with your bottom. Okay, get yourself in a comfortable position, and when during the night you need to turn over, you're going to try and use the muscles to sort of scoop in with your bump and scoop underneath with your pelvic floor, and move yourself around using your hands and just go round in stages. So this, as opposed to flipping from one side to the other, should be a little bit easier. And then get yourself comfortable on the other side. Now, another way to do it is to turn going underneath, and in order to do that, you're going to have to use your arms a bit more, and then 1, 2, 3, bring your legs through, take a breather, and then 1, 2, 3 again, bring your legs through and come down onto your side. When you're ready to come off the bed, you want to move yourself towards the edge, just holding onto the mattress, bringing yourself as near as you can to the edge of the bed, and you're going to bring your legs over, so make sure you've got enough of your legs just at the edge. Bring your legs over as you push with your arms, pushing with your hand, your elbow, walk yourself up as you bring your legs down, and then you bring yourself into that sitting position. Now, you may want to sit there for a few seconds at least until you get up from the bed. So what you're going to try and do then is make sure your feet are on the floor, and you're going to lean yourself forward and push up, leading with your head. Now, this might seem like, well, of course that's what I do when I stand up. But we all get into these bad habits, and when you're pregnant, a lot of the time you're sort of sat back like this, bumps kind of curved underneath, and then you're trying to get yourself up and forward from that position, and your tummy muscles are just going, no, I can't do that. So get yourself slowly up into a better posture, and then from there, both hands on the bed, lean yourself forward and push with your legs. There's nothing wrong with your legs, thigh muscles, glutes, those are the ones to do it. push up, and then if you feel that sometimes when you get up your blood pressure is a bit low, you get a bit dizzy, just pedal your feet. That can be a good one just to get a little bit more circulation pumping. And that's how you get on and off the bed, and you turn over in bed with less pain, hopefully. So if you're trying to get in and out of a car, what's the best way to do it? Well, if I was trying to get out of my car seat and I'm the driver, so in the UK we're getting out on your right hand side, so you would open your door and you would teeter your feet out, and obviously you've got to get over the lip of the car, and that's going to be different for different cars. But once you're on the edge, I'm on a chair that's swiveling a bit and I'm trying to stop it swiveling, you want to then use whatever you can hold on to try and help you to sort of pull yourself up. Obviously you can use your tummy muscles drawing in, your pelvic floor drawing up inside, and you use your leg muscles to push you up from as well. But you're on a low seat, unless you're in an SUV type car where you're higher up. You're having to get yourself out of that position, so it's a bit more difficult. So push on the chair, pull on the door of the car or the side of the car, and lever yourself forward. Obviously I've not got that to hold on to, but I'm going to push and bring myself up. Now getting into the car, same thing, sit yourself down and making those little tiny footsteps to get in, as if you're wearing a tiny little mini skirt and you're trying not to show your knickers. So you're just trying to do it very, very gradually, so you're not pulling on the pelvis. It's this kind of thing where people do that and have a big gap there at the pelvis, sitting down into their chair and sort of flopping in, that actually pulls more. So if you can do it carefully and turn yourself around, get yourself leaning forward and pushing up, then that's going to help you more. With getting in and out of a bath, you've got to get your legs over the edge of the bath. So do it keeping your legs together as much as you can, and then taking one leg over. You may need to lean yourself back if your bump's quite big in order to get in to the bath. And you may find that towards the end of the pregnancy, it's just not that easy getting in and out of the bath, and a walk-in shower works much, much better. And just standing up with your weight as even as possible in the shower, and taking the shower head down and moving it over any of those painful areas can be quite useful as well. So I hope these tips have been useful, and see you in the next video.